Professor Hahn, Professor Nichols, good to see you as always. Chris Hahn, host of the Aggressive Progressive podcast. Chris, start with you. Can you understand how some people are a little confused by the mixed messaging? Skeptical, perhaps?
Yeah, I mean, I can understand that. But the thing is, this is a new virus, and the science on it is continuing to evolve. The variants of this virus continue to evolve. It makes perfect sense for people working in a hospital on the front line where people are coming in infected, suffering with symptoms, should have a higher protection. We know that once you get a booster shot, you get the full effect of that vaccine, and that vaccine efficiency wears off over time where it goes down. So we don't want to have breakthrough infections among hospital workers who we need to continue to fight this disease. People need to be patient. It's going to change again. It's going to evolve again. We just have to face the facts that this virus is going to be with us for a while, and we're going to have to adapt to it constantly.
Chris, it's Friday. I thought you were going to bring us good news. All of this confusion, and of course...
I wish I could.
Yeah. All of this confusion and the mixed messaging, and to your point, some things are out of the president's control, but it has not been good for the president's approval numbers. He ran on bringing COVID under control. 8 months in, most recent poll, Biden's handling of the COVID-19 response, it's now 48 approved, 49 disapproved. That is down significantly. Jason, the president blames the unvaccinated for a lot of things. Are they to blame for his falling poll numbers as well?
No, I think there was a really rough month for the president, including Afghanistan and many other things. And COVID didn't seem to be getting better. And some of that falls on the unvaccinated. We know that, 1 in 5,000 vaccinated people actually end up in the hospital. It's much more likely, or 11 times more likely to die of the virus if you are unvaccinated. And so a lot of the numbers and a lot of the issues that we have are in these states where people are not vaccinated. So that is an issue. But the poll numbers, I think, are kind of an aggregate of some of the issues that the Biden administration has faced recently, including the border and including Afghanistan. I think when it rains, it pours. I think once a lot of these things get in under control, people are getting vaccinated and in a larger number. 75% of America has at least one shot. And we're headed, I believe, in the right direction. The numbers, even in those troubling states, are falling. I think you're going to see the president's poll numbers improve, and things are going to get better for him right in time for 2022.
As we said, he blames the unvaccinated a lot. Did that again today. Take a listen.
We were moving along on COVID-19, and now we have all these people who refuse to get a shot. And now look at the people dying.
Every public health official I talk to, Chris, says trying to shame people or bullying them is not the way to convince the unvaccinated. Why does the administration, who says trust scientists, keep doing the thing that scientists say is not going to change people's mind?
Yeah, look, you're not going to convince the unvaccinated at this point. We've got to mandate vaccines for different activities that these people would like to do, like fly in a plane or take a train between states. Once we start doing that, you'll see them get vaccinated, and this disease will slowly disappear from this country. I think, and I've talked about this with you before, Leland. I believe that the president's poll numbers on COVID are being impacted by progressives who don't think he's doing enough to do those things, to mandate vaccines across this country, to get these people safe, because they are not safe right now, and they are making it unsafe for children who can't get vaccinated and healthcare workers. So I think it's time for some significant increases in the mandates on vaccines.
You've been consistent about that. One group that's not happy with the mandates on vaccines, actually, is BLM, the Black Lives Matter movement. Newsweek reporting here, go ahead and put this up. There it is. Vaccine mandates put Black Lives Matter activists on collision course with Democrats. Black Lives Matter says vaccine mandates are racist. Jason Nichols.
Yeah, I think that, number one, I read that article that you just posted up there, and a lot of those people weren't part of the global network. A lot of people that call themselves Black Lives Matter activists, they may be active in some way, but they're not connected to the Black Lives Matter.
Yeah, but does that take? I mean, there's still people who are calling vaccine mandates racist. So Do they not have a point just
I
because
think
they're not
that-
part of the
so-
Black Lives Matter movement?
So I think that to make the broad statement that Black Lives Matter is against vaccines, I think is incorrect.
Okay, so
I do
how about
think
we'll make it simple. There's a number of people, and there's going to be a protest, we understand, in New York this weekend of people, many of whom are African American, saying that vaccine mandates are racist. What say you?
I think that's a different statement. And yes, there is a lot of vaccine hesitancy, and I think some of this falls upon like what you said in terms of the CDC sometimes not being consistent. I think it falls upon or not doing enough, as Chris said. I agree there. I also think that a lot of this falls upon our history and our present in terms of the medical apartheid that we have in this country, in terms of how Black people are treated by doctors and by physicians, not receiving pain medicine at the same rates, women dying while they're giving birth. I think that there are a lot of reasons why people have to distrust modern medicine.
Fair enough, but that sort of brings me. Fair enough, and you bring up a lot of very valid points that are real and play out. But I get back to what I was saying with Chris. Chris, is the way to get people who are fearing the vaccine or vaccine hesitant for the reasons Jason just described, is the way to get them vaccinated is with more mandates or education?
Yes. It's mandates. We've educated. We've educated everybody about this vaccine. It's free. It's available everywhere. People who are not getting vaccinated right now, we've tried giving them money. We've tried giving them college scholarships. It's time to mandate it. And look, the COVID virus does not care who you voted for president, does not care what color your skin is or where your family came from. It will kill you 10 times faster or 10 times more likely to kill you if you are not vaccinated. So everybody needs to get vaccinated. These people marching in the streets, we should set up a table to vaccinate them right there. It's ridiculous.
I agree and disagree with Chris. I do think...
Jason, I got 30 seconds why you disagree, then we got to go.
Yeah, so I disagree that we have educated sufficiently. I think we still need to educate people because there's so much disinformation out there to counter the education. We really need to push that very hard. I agree about mandates. I think that mandates are necessary, but at the same time, we can't give up on educating people, particularly when there's so much disinformation out there to counter it.
Professor, true to your profession.
That's fair enough.
Fair
enough.
We get agreement on Friday afternoon and evening with you gentlemen. Nice to see you both. Thanks. Always a good conversation.
Nice to see you.
All right, the White House. Well, they talked about a lot